Brought to you by Holy Name Medical Center in Teaneck, New Jersey.
Welcome to New Jersey Capital Report, coming to you from the Agnes Veris NJ TV studio in the great city of Newark, New Jersey. I'm Steve Adubato.
And I'm Rafael P. Roman. You know, since the Affordable Care Act went into effect, the number of New Jersey residents covered by some sort of health insurance has increased dramatically. But has that helped ease the financial pressures on New Jersey hospitals? Joining us now to answer that question is Suzanne Ianni, the president and CEO of the Hospital Alliance of New Jersey. Suzanne, welcome.
Thank you. Thank you for having me.
So first of all, what is the Hospital Alliance of New Jersey?
Sure. We're an organization of 17 safety net hospitals. So safety net hospitals that are in your cities like Newark, Camden, we span the state. And our main goal is to really educate policymakers on the challenges that safety net hospitals experience in providing access to care. We talk about specific funding issues and also, you know, comment on ACA and budget.
Okay, so the ACA.
Yes.
A lot more people covered in New Jersey. Has it helped the financial pressure that so many New Jersey hospitals are under and were under before the ACA?
So there are a couple of stories here. The first that everyone hears is the impact on consumers. And it absolutely helped consumers. As Rafael said, many more New Jerseyans are covered by some form of insurance. About 700,000.
That's a good thing.
That is a great thing. We're very grateful to Governor Christie for supporting Medicaid expansion. It's a wonderful thing because patients who did not have insurance now have access. They have a Medicaid card. They're going to get the services that they didn't get in the past. So if they needed a colonoscopy or a mammogram, now they will get it. So that's the good news story.
Okay, Suzanne, could you give us the other part of the story?
So the other part of the story. So what does that mean for hospitals like mine?
By the way, when we say safety net hospitals, charity care, these are the hospitals disproportionately in urban areas that treat those who come into the emergency room that by law must be treated whether they have insurance or not.
Absolutely.
I just want to clarify.
Yes, and all hospitals in New Jersey have that obligation. But what makes my hospitals different is our payer mix. So for those of you who may not know what payer mix is, if you look at, let's pretend that 10 patients represent all the patients at a hospital. For my members, like a hospital like University, 6 out of 10 of those patients are Medicaid or uninsured.
In Newark?
In Newark. Right here in Newark. So that's much different than a hospital in a more affluent area of the state where they may have 2 patients that are Medicaid or uninsured.
So the other story about the Affordable Care Act is?
So from the provider side, it's pretty fairly common knowledge among policymakers that New Jersey's Medicaid rates only reimburse about 70% of the cost of the care.
Of the actual cost.
Of the actual cost. So while it's a wonderful thing that folks are coming in and getting all the preventive tests that they needed to get that they couldn't get before when they didn't have an insurance card, but for every time somebody comes in and gets a mammogram, we're not paid for the cost of that care. So we're losing money. And you've seen headlines where hospitals have received more Medicaid revenue. That's a true statement. But if the revenue doesn't cover the cost, that can't be used as a justification to make other cuts.
So the more Medicaid you use, you're actually losing more money.
Absolutely. There's a shortfall associated with every time a Medicaid patient comes to a hospital.
So just as you were coming into the studio, we're taping actually on the 24th of May. And you actually said, and some people have read this in the newspaper, trying to put this in perspective, there's a cut, and again, when this airs in a few weeks, this issue may have been resolved, but right now, there's an additional cut to charity care, the dollars that are supposed to come from the state and or federal government to reimburse your hospitals for the care you give to those who come to the emergency room without insurance. What's going on?
Yes, what's going on? Well, so just backstory. Last 2 years, we already endured a cut of $148 million last budget. The governor for state fiscal 17 proposed a $150 million cut. So over 2 years, that's a $300 million cut in the state budget. So half of that is state money, half of that is federal. Just the other day, a couple of weeks ago, by the time this tapes, the state treasurer said to fill a budget gap, they're going to cut another $25 million in state dollars to the charity care program. Now, what that means is we actually are throwing away $25 million in federal dollars.
Because it's a match?
Because it's a match.
Because it's a match. So I don't envy those who have to put the state budget together, but really in a $30 billion budget, $25 million is de minimis.
But why,
can they find that $25 million somewhere else?
But why is charity care being cut at all? If, as you just told us, the ACA does not, in effect, bring you more money, why then is charity care being cut in the first place?
Well, I think you can look at a lot of factors, Rafael, and I think that people are taking the story away that the number of uninsured in New Jersey has gone down and documented charity care has gone down. Those are true statements, although there's still 1 million uninsured in New Jersey, so there still is a need. I believe that there's a misconception that hospitals, this new Medicaid revenue, can offset the losses, or can offset what they're proposing in a cut.
Is that misconception, do legislators also have that misconception?
I think it's common because what you read in the newspaper is the ACA was a success, and it was.
Translation.
Right.
More and more people are covered under the Medicaid expansion. Therefore, you don't need as much for charity care. That is what's going on.
And then also, those in the exchange products, almost 300,000 New Jerseyans have purchased insurance through the exchange.
You're talking about on the exchange, but
Yes.
Obamacare,
Not
the
Medicaid.
ACA.
Not Medicaid.
They're going on the exchange.
Right.
So therefore,
that's good news too for the person who has an insurance card. But what people don't understand, the unintended consequence, is a lot of those plans have high deductibles. So there could be a $5,000 deductible associated with somebody's insurance. They have to go to the hospital. The hospital submits the bill for their copay and deductible, and they can't pay it.
That's what bad debt is.
That is what bad debt is. So that's
what's going to
another
happen with
unintended
this?
consequence.
So you're fighting to get that money back?
Yes, we really want to work with the governor and the legislature to find somewhere else to get that $25 million, so that we're not, causing $50 million in pain to our healthcare safety net.
Final question before we let you out of here. These hospitals who treat the people who otherwise would not have the ability to pay, don't have the insurance, what is the responsibility you believe that others who live in different communities that have insurance with, let's just say, with hospitals and medical centers that are frankly more established financially, what do you think the responsibility everyone else has to those patients in those hospitals?
Well, I do think in New Jersey there is an all-comers law. So every hospital in New Jersey does have to accept a patient regardless of ability
But the
to pay.
payer's mix is different.
The payer mix is different, absolutely.
Yeah, so
I
what
think there
Steve
needs
is
to be a
saying is,
recognition from the industry that we are carrying a larger percent of...
Disproportionate.
Absolutely.
Minute left, make the case.
Those are the words, disproportionate. And actually those dollars, if you look at the federal intent, it's only for hospitals with a disproportionate burden. If they were intended for all hospitals, they would be called proportionate share
You're not
dollars.
answering the question. We've got 45 seconds
Yes.
left. Does everyone else have a responsibility in other communities to help the patients that your hospitals are taking care of?
Absolutely. We all have the obligation to
And if they don't?
provide health care access.
If they don't?
Maybe they don't get charity care dollars. I don't know where you're going with that, Steve.
Well,
but-
what happens to those people?
Right. What happens to those people is they will seek care at our hospitals.
And nothing
Right.
good happens there. And by the way, we're trying to keep people out of the emergency room.
We are, and we
Yes.
need money for innovation to do that, to provide care managers and manage people's cares, because our patients have social determinants of care
Suzanne,
that
thank you
cause
so much.
challenges. Thank you.
Well
I hope
said.
I answered your
Suzanne,
question.
thank
You'll
you
come
so
back
much.
again.
Yeah.
Okay.
You got this, Rev?
I do.
Go ahead.
Recently, Steve had the opportunity to sit down with Adrian Carrasquillo, editor of Latino coverage at BuzzFeed News. They spoke about the impact of Latino voters on today's politics, and here now is that conversation.
My name is Dr. John Rundback. I'm actually the medical director of the Interventional Institute here at Holy Name Medical Center. Peripheral arterial disease actually is extremely common. It's one of the forms of hardening of the artery. As interventional radiologists, we perform minimally invasive image-guided procedure. Generally, the procedures we do are alternatives to what would otherwise be major surgery. Almost 80% of those patients can avoid amputation if they're referred for us for these sort of procedures.
Holy Name Medical Center in Teaneck, New Jersey. 1-877 Holy Name. Healing begins here.
Also brought to you by the New Jersey Education Association, MagnaCare, and by the New Jersey State Nurses Association and the Institute for Nurses.